They try to take control in the wrong way. They decide to drive themselves to the hospital. Or worse, they convince themselves that they'll feel better if they just rest a little, lie down, drink some water, wait it out. That is not control. That is denial in disguise. And in the middle of a heart attack, denial is not your friend, it's your executioner. What you must do is deceptively simple, but it requires courage, humility, and a shift in mindset. You must call for help immediately. Wherever you are, at home, at work, in a store, you call emergency services. You dial 911, not your spouse, not your neighbor, not your son or daughter. You don't need a consultation, you need transportation. Medical transportation, professional transportation, professional transportation. Because here's what most people don't realize. When you call emergency medical services, you're not just ordering a ride, you're activating a team. You are summoning trained personnel who will start diagnosing and treating you before you even arrive at the hospital. They bring oxygen, they bring defibrillators, they bring medication, they bring calm in the middle of chaos. And timing matters. The faster the EMS team gets to you, the faster you can receive the one thing that can make all the difference: treatment during the golden hour. That's the term we use in cardiology, the golden hour. The first 60 minutes from the onset of a heart attack. That's the window in which treatment is most effective at limiting permanent damage to the heart muscle. Every minute you delay, every single one narrows that window, sometimes irreversibly. Now let's talk about why this is psychologically difficult. Calling 911 feels dramatic. It feels like an overreaction. You might think, what if I'm wrong? What if it's just heartburn? What if I go to the hospital and they send me home? Let me reframe that for you. What if it is a heart attack and you don't call? What if you choose hesitation over survival? There is a kind of pride that can become toxic in emergencies. We don't want to look weak. We don't want to be a burden. We want to keep things tidy, under control. But health isn't always tidy. The heart doesn't care about your image. Your survival depends on your ability to override ego with wisdom. There's also something deeply philosophical at play here. When you call for help, you are acknowledging the universal truth. We're not meant to go through life alone, and certainly not through a crisis alone. There is a beauty in allowing others to step in, especially when their expertise could mean the difference between life and death. I've seen too many patients arrive at the hospital too late because they tried to be their own hero. They wanted to tough it out. They didn't want to cause a fuss. But here's the irony. The real hero is the one who knows when to surrender control to the right people at the right time. Think of the call to emergency services as an act of self-respect. It is not panic, it is precision. It's not weakness, it's wisdom in motion. And if you're in a situation where you see someone else having symptoms, your role is equally clear. Do not ask them if they want help. Don't wait for them to feel ready. Take action. Call for them. Be their clarity in a moment of confusion. There's a powerful human principle at work here, and it extends far beyond heart attacks. In moments of crisis, the speed with which we reach out for help often determines the outcome, not just in medicine, but in life. The heart is a metaphor as much as it is a muscle. It teaches us that strength is not in isolation, but in connection. And it is that connection, initiated by a simple phone call, that begins the chain of survival. So if you remember nothing else from this part of our time together, remember this. When seconds matter, don't negotiate with doubt. Call. Don't drive. Don't wait. Don't talk yourself out of it. Take the call. Because in that moment, you're not just reaching for help, you're choosing life. And there's no greater act of strength than that. Let me say this directly. The moment you suspect a heart attack, the very first thing you must do without hesitation is call emergency services. You call 911, not your spouse, not your neighbor, not your grown children, not even your primary care doctor. Why? Because emergency services aren't just there to take you to the hospital. They bring the hospital to you. People think the ambulance is just a ride. It's not. It's a mobile emergency unit. The professionals who arrive aren't just drivers. They're trained paramedics equipped to begin life-saving interventions the moment they reach you. They can administer oxygen, perform an electrocardiogram, give clot-busting medications, and prepare the hospital team for your arrival, all before you ever walk through the doors of an ER. Every minute saved increases your odds of survival and reduces the damage to your heart. And in this case, minutes truly are muscle, heart muscle. Once it's gone, it doesn't regenerate. But here's where things get interesting. It's not just a matter of logic, it's a matter of psychology. One of the most powerful forces in human behavior is the tendency to downplay. We minimize our pain, dismiss symptoms, and delay decisions because the alternative, admitting we're vulnerable, is uncomfortable. We don't want to look weak. We don't want to cause alarm. But I would argue that true strength is the ability to act with clarity, not ego. It's the wisdom to say, I need help, and the courage to pick up the phone. I've spoken with countless patients over the years who said, I didn't want to bother anyone, or I didn't want to make a fuss. But the irony is that hesitation, rooted in a fear of overreacting, can lead to the very outcome they were trying to avoid, a crisis, or worse, a funeral. It's also about control. Many people feel that calling 911 means they're handing over control of the situation. But let's flip that idea on its head. Calling for help is an act of control. It's you saying, I recognize this moment, I respect it, and I'm going to respond the most effective way possible. That's not surrender. That's leadership over your own life. And let's not forget how our culture has shaped our thinking. We reward stoicism. We idolize those who push through pain. But in the realm of cardiac health, stoicism can kill because you're not just pushing through discomfort, you're pushing through damage. Damage that could have been limited or even prevented if you'd made one decision to call. Even the logistics matter. If you drive yourself during a heart attack, you're risking losing consciousness behind the wheel. You could crash, you could hurt others, and by the time you reach the hospital, you've already lost precious minutes and you arrive alone without the medical preparation that EMS would have provided en route. It's not faster, it's not safer, it's simply not wise. Now let's widen the lens. Imagine you're not the one having the heart attack, you're with someone else. A spouse, a friend, a stranger at the grocery store, and you see the signs, pale face, sweating, shortness of breath, clutching at their chest or jaw. Your instinct might be to ask them if they want help. Don't. Act. If they're conscious, calmly reassure them and call emergency services. If they resist, it's okay. Call anyway. Because hesitation is a privilege we can't afford in these moments. Here's what this all comes down to. Clarity under pressure. That's the real test. In those first 5 minutes, you don't need to be perfect. You don't need a medical degree. You need presence. You need decisiveness. You need to reach out, to summon help, to open the door for professionals who can stabilize, support, and save you. This is not about fear. It's about precision. When you know the stakes, you don't hesitate. You don't wait for certainty. You act based on wisdom. You act because you know that in matters of the heart, both emotionally and biologically, time is everything. So if you ever find yourself in that moment and your heart is crying out for help, don't second guess. Don't explain it away. Don't try to be a hero. Just call. Because sometimes the strongest thing you can do is let yourself be saved. Now, let me be clear. I'm not talking about any pill, any painkiller. I'm talking specifically about plain, uncoated aspirin. And I'm not suggesting you swallow it like you would for a headache. I'm telling you to chew it. Why? Because aspirin has a very unique and critical property. It thins the blood. During a heart attack, what's happening inside the body is essentially a blockage. A clot or buildup has narrowed or completely obstructed a coronary artery, cutting off blood flow to part of the heart muscle. Without oxygen-rich blood, that muscle begins to die. It doesn't take hours, it starts within minutes. The faster we restore blood flow, the more muscle we save. Chewing an aspirin, ideally 325 milligram, allows it to enter your bloodstream more rapidly than swallowing it whole. When you chew it, the aspirin begins dissolving and absorbing through the tissues in your mouth and stomach before it even reaches your intestines. Within minutes, it begins to interrupt the clotting process, making your blood less sticky, less likely to worsen the blockage. This single step can begin reversing the cascade of damage happening inside your arteries. It's so simple, and yet I cannot overstate how effective it can be. In fact, many cardiologists, including myself, consider this the first medication that should be administered during a suspected heart attack, often even before you reach the ER. The evidence is that strong. It's not a home remedy, it's frontline therapy, backed by decades of medical research. But it's only effective if you use it at the right moment, not an hour later, not when someone confirms the diagnosis, but immediately, right when the symptoms begin and you've called for help. Now, why don't more people do this? Part of the reason is that we often associate aspirin with minor ailments, headaches, joint pain, maybe inflammation. We don't associate it with something as serious as a heart attack. But therein lies the philosophical shift we need to make. We need to stop underestimating the power of simple actions. There's a quiet brilliance in ordinary things. A tablet that costs a few cents can tip the balance between life and death. Think about that. In a world where we chase the latest technology, the most advanced devices, sometimes the most effective lifesaver is a tablet that's been around for over a century. Of course, not everyone should take aspirin indiscriminately. If you've been told by your physician that you have a bleeding disorder, an allergy to aspirin, or certain gastrointestinal issues, then you should avoid it unless specifically instructed. But for the vast majority of people, especially those over 50, those with diabetes, high blood pressure, or a family history of heart disease, keeping uncoated aspirin nearby and understanding when and how to use it is a vital act of preparedness. There's something psychological here as well. When we're in distress, we often feel powerless. Our hearts are racing. The pain is confusing. The fear sets in. But taking action, even something as small as chewing an aspirin, can ground you. It gives you purpose. It sends a message to your mind and body. I am not passive. I am participating in my own survival. That shift in mindset from helplessness to empowerment is profound, and it matters. This is also about stewardship, about being ready, not just for ourselves, but for those around us. Because the truth is, it might not be you who has the heart attack. It might be your spouse, your parent, your colleague, your friend at the gym. And if you're the one who knows what to do, if you're the one who has the aspirin ready and the knowledge to act, you become a bridge to their survival. Preparation is not paranoia. It's love in action. A bottle of aspirin in your kitchen drawer isn't just a bottle of pills. It's a statement. It says, I value this life and I'm ready to protect it. In a world filled with uncertainty, that kind of readiness is rare, but it's also within reach. So the next time you check your cabinets or prepare your emergency kit, remember this. Survival often begins with something small, something humble. One tablet, one action, one decision made in a moment of clarity. Because sometimes the most powerful medicine isn't the one that waits for you at the hospital. It's the one you take before you even leave your front door. In those intense, uncertain moments, the natural instinct is to panic. And understandably so, your heart is in distress. Your body is sounding alarms. Fear rises fast. The breath shortens. The mind races through worst-case scenarios. But here's where we must remember something profound. Panic is not a necessary response. It's a conditioned one. And just because it's common doesn't mean it's helpful. In fact, panic can worsen the situation significantly. When you panic, your body releases adrenaline, a powerful stress hormone that increases your heart rate and blood pressure. That's the last thing your heart needs in the middle of a crisis. Panic essentially throws gasoline on the fire. It turns an already dangerous situation into one that can spiral out of control, which is why in those few minutes while you wait for help, you must do the hardest and most important thing, stay calm. This doesn't mean you ignore what's happening. It means you consciously choose to control the one thing still within your power, your breath. Breathing, when used correctly, is not just automatic, it's medicinal. Deep, steady, intentional breaths signal to your nervous system that you're safe, that you're handling the situation, that you're not spiraling into chaos. And when your nervous system receives that signal, it responds accordingly. It lowers the heart rate, reduces blood pressure, and eases the oxygen demand on the heart. It stabilizes the body during a moment that feels anything but stable. This isn't mystical thinking, it's physiology. The vagus nerve, which plays a central role in regulating the parasympathetic nervous system, responds directly to deep breathing. With each controlled inhale and each slow, deliberate exhale, you send a message, I am present, I am not afraid, I am here. And here's something I often tell patients. Sitting still is not doing nothing. In a crisis like this, sitting or lying down in a comfortable, supportive position is an act of precision. It reduces the workload on the heart. It protects you from injury if you faint or feel dizzy. And it creates the space, physically and mentally, for your body to stabilize while help is on its way. In fact, doing less is one of the most powerful things you can do in a heart attack. Don't try to walk it off. Don't pace the room. Don't go looking for your insurance card or start texting family members. Your job is now to be still, to breathe, and to trust that the steps you've already taken are in motion. There's a deeper lesson here, one that extends far beyond this medical moment. So often in life, we believe that action is the answer to everything, that doing more, moving faster, solving harder is how we survive and succeed. But in reality, sometimes survival comes from stillness, from quiet, from being able to say, I've done what I need to do, and now I must allow what comes next. It's an exercise in surrender, not in weakness, but in wisdom, because surrender doesn't mean giving up. It means giving over to the process you've already started. You've made the call, you've taken the aspirin, the professionals are on their way. Now your role is to create the best possible internal environment for your body to hold on, to endure, and to heal. Even in emergency medicine, the mind matters. And this is where philosophy and physiology meet. The body reflects what the mind believes. If your thoughts say, this is the end, your body will contract in fear. If your thoughts say, this is hard, but I'm okay, I'm doing the right things, your body will align with strength, not despair. I often remind people there is a sacred power in the breath. It is the bridge between what you cannot control and what you still can. Inhale deeply, hold it for a moment, then exhale slowly. Do it again. Focus on the breath instead of the fear. That rhythm becomes your anchor. In the storm of uncertainty, it becomes your lifeline. So if that moment ever comes and you're caught in the narrow window between crisis and rescue, remember this simple but life-altering truth. Calm is not a feeling you wait for. It's a decision you make. Choose calm. Because in the stillness, in the breath, in the pause, you give your heart the space it needs to keep beating.